The key area was the first audit, I think, because then we had evidence to show where we were not performing. And like everybody else, we were quite happy with the other areas that we were performing in as a group and a practice. And we knew that clinically and otherwise we were performing well and that our patients were satisfied as we would have felt. But our level of service wasn't there as good as it should have been. And then after the audit, I think we had evidence, we went and looked at it. And then when Alpha came on stream, we took Alpha on to manage our premises and our practice. And during that time then, procedures and protocols were set in place that we still use to this day and have made our practice run a lot more efficiently and effectively. And I think the big thing about it was, rather than sitting there worrying like we did in the past about must do this, must do that, we handed over to somebody outside. And I would say the pressure, removing the administrative load, was as beneficial as the end result of the change in the practices. I think the big benefit was looking at it in a totally different way. So rather than where we look at it from back here in our surgery, looking out and wondering, are the process and the procedures working okay, it came in from the outside. So the patient pathway from the front door in was analysed from the patient satisfaction viewpoint. Then all procedures, financial and management, we can split it in two. So there's a patient satisfaction side, waiting times, looking at waiting times, how the patients are dealt with as they come through. Their pathway was looked at. Our appointment times were looked at and how efficient we were at running it. And then you come back and you look at what was looked at was our financial management, which definitely needed to be improved. And procedures were set up in place in that. And then our management structure. I think the big thing was we have very good staff, and Alpha recognised that and worked with our staff. And I think we were able to get our staff to another level where they were more aware of their roles and responsibilities. Before, we had an enthusiastic, capable, very intelligent, very good staff, but they didn't have a direction in some of their jobs, and it was just a matter of somebody coming in from outside, looking at it differently. Come back to the patient. The patient now has a more clear pathway through. We're gone to appointment-only system, and we've a more efficient patient care system in place. Also, when you talk about patients, I think if a practice is managed well and runs well, I think you'll have to improve your clinical side. We had an independent professional coming in who looked at us from the front door in and out, every aspect of what we did, in a professional, scientific way. It wasn't we just got, maybe you're doing this badly, maybe you're doing it. We had stats and figures to say, look, this is not working well, maybe we could try this system. And I think the implementation of the change, because change is uncomfortable, and even if it's change for the good, it can be uncomfortable. So there's a knack or a skill in working with change and working with people for change. And here, our experience was Alpha worked well with our staff.